Good afternoon. I'm David Sweat, Deputy Director of Shelby County Health Department, and welcome to the City of Memphis and Shelby County Joint COVID Task Force briefing, joined today by Director Alisa Haushalter and Dr. Bruce Randolph, our local health officer. Just to give you an update on the numbers, we have 85,234 cases reported today. That is 158 new cases that came in yesterday. We also have 1,387 reported deaths from the COVID pandemic. In the surrounding counties, in Crittenden County, Arkansas, we have 5,176 cases reported. In Tipton County, Tennessee, 6,657 cases reported. Fayette County, Tennessee, 4,351. And in DeSoto County, Mississippi, we have 18,838 cases that have been reported to date. As far as our vaccination updates, in Shelby County, we have vaccinated 83,220 total doses administered, including 61,078 first doses and 22,142 second doses that have been administered so far. So that's where we are for the general number updates. As far as for the Tennessee's total number of cases, 745,826 cases have been diagnosed in the state of Tennessee. Now, one of the things that we mentioned last time that we were talking about investigations of importance in the county was the surveillance effort to detect variant strains or potentially emerging variant strains that we would be concerned about. And we do continue to work with local laboratories and UT Health Science Center to conduct that surveillance. As we reported previously, there was a presumptive positive variant from the United Kingdom strain that has been detected in Shelby County. And this past weekend, we now have a presumptive positive of one of the Brazilian variants in the community. Those investigations continue. And at this point, what we would be able to say about it is that we are not alarmed that these strains are being detected, because we here in Shelby County are conducting a pretty robust effort of surveillance, trying to find these variants. We don't find very many. Right now it's only a couple of patients that have been proven to have these variant strains, but we will continue to look for them. And as always, we coordinate and cooperate with the Tennessee Department of Health and share information with the Centers for Disease Control. So we'll keep you updated on any developments there as they occur. And with that, I'm going to turn it over to Director Alisa Haushalter.
I want to primarily give updates today on vaccine distribution. I know there's a lot of questions and things are evolving very quickly and changing day to day, so I want to make sure we're keeping people updated on that information. As David indicated, we have given 82,000 vaccines here in Shelby County. That's data that was provided to me by the state yesterday. And what we do know is that there is an expectation from the state that in any community, there's about 20% of the doses that were sent that aren't administered yet. And that's because those are second doses that are already scheduled for somebody in the near future. So you may see on the state website a little bit of a variance between what they've sent to a county and what that county has actually distributed at that point. So again, based on the state data yesterday, was 82,060 doses administered and 138,000 doses have been sent to Shelby County. And at the current time, there are multiple places that receive vaccine. So the Shelby County Health Department, as well as the healthcare systems, the City of Memphis, all of the safety net providers, which includes the federally qualified health centers such as Memphis Health Center, but also the faith-based providers such as Church Health. We also know that doses are going to Walmart, and that's not counted in our overall allocation weekly, and the Veterans Administration is receiving vaccine from the federal level. So while there are a number of places receiving vaccine, our total number of doses received per week is actually still, in my opinion, fairly low. So this past week, we received about 15,000 doses, but for the remainder of this month, we'll receive a little bit over 11,000 doses to be distributed throughout the county. That's first doses only. We will receive second doses based on what was given the prior 3 weeks or 4 weeks respectively. So I also wanted to talk about distribution of vaccine by race and some of the data that you may see either on the state website, the Shelby.community website, or in the media. The recording of all of the vaccines is in a system called TENNIS, which is the Tennessee system for gathering vaccine data. At the very beginning of the vaccine rollout, that database did not allow entry of information on race and ethnicity. So we actually have a significant portion of information that's missing. So of the over 80,000 doses given, about 19% of those do not indicate the race and ethnicity of the individual that received the vaccine, and about 36% do not include ethnicity at all. What we do know is that the state has corrected that in their system, and so over time we anticipate that percentage that doesn't have race or ethnicity to decrease. But as we know currently, about 43% of our doses locally that we do have race for have been given to people who are Caucasian, and 22% to individuals identified as African American, and 14% to those identified as other. Based on the information from the state yesterday, that's actually significantly higher than the rest of the state. And so while we need to continue to focus on equity and inclusion, we are far ahead of some other areas of the state in reaching our most vulnerable communities. A few additional updates on vaccine rollout. I want to remind people to go to Shelby.community on a regular basis. We will, as much as we can, continue to open up appointments as we have vaccine available. Currently, there's vaccine appointments that were made for Pipkin, Appling, and Germantown. People can still, if they are commodity foods recipient, receive their vaccine at the commodities site. And we do anticipate continued delivery of vaccine at the Southwest Campus in Whitehaven. And again, we're looking for a more permanent location in the Fraser area. As we receive more vaccine, we will continue to distribute more widely, and we ask everyone to be patient. It's a very challenging time for everyone because there's much greater demand than there is supply. And then I wanted to end with some key things about when a person can get the second dose. When an individual receives the first dose, they're going to receive a little white card that says if they receive the Pfizer vaccine, they should get their second dose on the 21st day. If they receive the Moderna vaccine, they should receive their dose on the 28th day. In actuality, you can receive your vaccine anytime after the 21st day or after the 28th day. We get a lot of inquiries asking about their vaccine expiring. So the second dose serves as a booster, and there's not an expiration date for that. We do encourage people to get it within 6 weeks of that 21st or 28th day. But if you don't get the vaccine right on the 21st day or the 28th day, you're still okay. And as we have sites available and more partners and more vaccine, then we will be able to open up those appointments. I'm going to end there and turn it over to Dr. Randolph. Thank you.
Thank you, Dr. Haushalter, Mr. Sweat. Greetings, fellow citizens of Shelby County. I'm Dr. Bruce Randolph, the health officer. I just want to highlight a few things that actually have already been mentioned. If you notice, our new cases for today is 158. Our 7-day average has been 285, 14-day average 303. And our positivity rate is 8.9. I want to thank you, Shelby County. I want to thank you for your cooperation. Thank you for adhering to the safety measures we implemented. Thank you for wearing your mask. Thank you for practicing social distancing. and avoiding the crowds and gatherings. Because I believe that it's through your efforts that we're able to report these numbers that are showing a downward trend. Now my ask is that we continue the course. Let's not stop now because we're making progress, especially in light of the fact that we have learned that we do have at least 2 variant cases occurring here in Shelby County. Our approach to preventing the spread of this virus is the same. If we continue to do what we're doing, we can prevent it from taking hold and spreading in our community. So I really urge you to continue the course, remain steadfast, continue to wear your mask, practice social distancing, staying apart, don't gather in crowds, etc. Now, as you know, we're approaching almost 3 weeks since the health directive number 17 was issued. Therefore, we're approaching the 4th week in which we will look to see what changes we can make. We're beginning to have some discussion among the team in terms of changes as a reflection of the changes in the data. So more to come, and we will be looking to issue a new health directive sometime in the next week or so, especially if the trend continues downward as it is. With that, I will stop and entertain any questions you may have.
Kelly Roberts, WMC.
Good afternoon. My first question is about second doses. So we know Arkansas, Missouri, and Mississippi, when you get that first shot, your second shot appointment is scheduled immediately. And I know that Dr. Randolph had mentioned that you guys are working towards something like that. Could you walk us through what kept you from enacting that from the get-go? Why it didn't happen from the beginning? Any concrete steps being taken to, get all those people who need those second dose appointments scheduled?
I'm going to let Dr. Haushalter answer that question.
So from the beginning, what kept us from doing it that way was we did not know if and when we were going to receive the second doses. That first week, we focused very heavily on healthcare workers as well as EMT, paramedic, but other first responders. And that was a little bit under 10,000 individuals. We could not appoint those for a second appointment until we knew that the Moderna vaccine was coming and when it was going to arrive. That actually started what I would say the rhythm of things, which is not ideal. The other has to do with some technology limitations, but we are working locally as well as with the state to resolve some of those technology limitations to be able to schedule the second appointment in a more timely manner. Your follow-up?
Yeah, thanks. I know that you all have been inundated with questions from people, as have a lot of the media outlets. And I mentioned just, those concrete steps that are being taken to get people those second dose appointments. Dr. Fauci did say that he believes that these timeframes should be followed. I know other doctors, including the health department and the state health department, have said that there is that leeway. People really want communication. They want answers. What are you telling people that is being done today definitively to get people shot appointments for their second doses as close to that date that, that is originally recommended?
So a few things. One, we are working on technology, and again, that's in partnership with the state as well as our local IT to be able to schedule second appointments at the time that either the first appointment is made or when they get their vaccine, and we'll continue to work on that throughout the week. The other is ultimately changing the process so that it doesn't matter if you're there for a first or second dose, but that you actually, if you're getting Pfizer, you're getting Pfizer, so that you don't have to separate those clinics out, because manpower does become a a contributing factor. You know, I've noted before, we do have a nursing shortage, and it's important that we have sufficient staff to be able to administer vaccine. And then also we're making improvements to the 222 shot line by improving the way that that call center operates and the number of individuals that are assigned to answer those particular calls. And you're right, as close as you can get to the 21st or 28th day is critical and very important, and we'll continue to work to improve those appointments.
Siobhan Riley, Fox 13.
Hi, I just wanted kind of touching on Kelly's question as well. What happens if people have to wait longer than 3 weeks to get that second dose?
So it doesn't have a negative impact on the outcome. I think what is most important is it causes people a lot of undue anxiety because they want to get that shot on the day that they believe it should be given, which is the 21st or 28th day. But from a vaccine perspective, whether they got it on day 28 or 29 or 30 is really not going to make a difference in their immunity to COVID.
And my next question is, most of the surrounding counties are getting vaccinated. The teachers are getting vaccinated in that 1B group. I know that you've mentioned before, because Shelby County is a larger county, sometimes it takes longer. But what is next for Shelby County if that 1B group cannot get vaccinated in a timely manner?
So I wouldn't say whether it's a timely manner or not. It's what phase we're in and the guidance provided by the state health department that is based on epidemiology. So we know that we have to get 1A1 and 1A2 completed, but most importantly, we also have to get 70 and above completed. When I say completed, a good portion of that population needs to be vaccinated because those are the individuals most at risk of contracting COVID, spreading COVID, and potentially dying from COVID. So it's important to do those groups first, and the fact that we have the largest population in the state does impact how quickly we will move to the teacher category. The other thing that I know you've used your 2 questions, but if I were you, I would have another question which has to do with Davidson County and their decision to move forward with vaccinating teachers. So we work very closely in partnership with the state health department. Yes, we're an independent metro, but we do look to them for guidance. They have a bigger picture view and direct contact with the CDC. And their recommendation to us locally 2 weeks ago was not to move to teachers before we completed some of those other categories. Davidson County made an independent decision to move forward with teachers, even though they may not be ready to move into that particular category. At the current time, we're going to rely on 2 things. One, maybe it's 3 total, but our data, epidemiology, which is to protect those most at risk of death first, and then our partnership with the state health department. So at the current time, we anticipate we would likely move into the category that teachers are in, that phase, probably the beginning of March.
Fred Broders, Local 24.
Thanks, Dr. Haushalter. Good afternoon. Touching on what Kelly and Siobhan were asking about, could you just kind of tell the public, just reiterate the supply challenges right now? I know you opened the second day of second doses for Friday. They were out within minutes. What kind of supply issues are there right now? I know to set aside the second doses, but what are the supply challenges you all are dealing with in the coming weeks when these first doses are due for their second dose?
So I would say there's actually 2 categories. One is supply, but others is logistics and staffing, and that's an important component. So I do want to say publicly that the supply chain is improving. Previously, I said it was very important to have predictability as well as to know what amount we would receive weekly, and that is improving. So previously, we would find out over the weekend what our allocation was, and we would receive that on Tuesday. Now we will be able to have a better sense on Thursday of the week prior of what our doses are. And when I say doses for the county, again, they're divided up, so that's not all that's allocated to the health department, but that'll usually be clear by Friday. And then this past week, we actually were given notice that we should expect a level supply for the remainder of February with a few adjustments of what the health department received. So that will allow us to plan better moving forward. But previously, it really was a last minute, here's how many doses you're receiving, and then we had to set up appointments from there. So I think it'll continue to get smoother because of that predictability. We do understand that we will likely know from this point forward 3 or 4 weeks at a time what our allocation will be. So that'll help with scheduling and with our partners. The other has to do with staffing. There is a need for a significant number of human resources at any site. That includes for parking lot, checking whether people have appointments, those who give vaccine, and those who are actually monitoring, and then those who are running in between with vaccine to make sure we have sufficient supply. And we have to make sure we're able to coordinate those for each of the sites as well. And so if we don't have clear predictability on the amount of vaccine and when it's coming, it's difficult to plan for staffing. So again, that is getting much better and has gotten better really over the last week, and I think that'll improve things as we move forward as well.
Thanks, Dr. Haushalter. As my follow-up, I know you discussed this on Thursday, but if people are watching this right now, there's been a lot of concern, frustration about not connecting. The slots go out within minutes. I miss it by 10 minutes, and they're full. What's your message to the public? And just as another quick follow-up, is there any estimate on how many percentage the 70 and up population has been vaccinated so far?
So I don't know for the 70 and above yet. I know for the 75 and above, we were getting closer to 30%. Probably later in the week, we'll know more of the 70 and above percentage and can present that on Thursday. I think in general is to just remind everyone there is a significant amount of demand for vaccine with limited supply. And those appointments do go very quickly, but we do monitor throughout the day, and as we can, we open up more slots. So an example is we did open up in partnership with Germantown an additional day dedicated to second doses in partnership with Germantown. The city of Memphis has reached out to say, okay, how can we assist? So we will continue to make adjustments as we know we have vaccine available and we have demand for appointments.
Jacob Steimer, Memphis Business Journal.
Yeah, thank you. First question is about case rates. They're not just dropping here, they're dropping in the nearby rural counties. Where mask usage doesn't seem nearly as widespread. I'm curious why y'all think local rates have been dropping across the region.
Well, one of the things we know about West Tennessee, and we've said it from the beginning, we can't view Shelby County in isolation, that what happens in the rural counties impacts us and what happens here impacts the rural counties. So we know that there's similarity between them, but also even though there's not masking in all of the rural counties, there is more masking likely than there was previously, and that has made a significant impact as well. And then there's increased testing available in those areas as well. You have a follow-up?
And then in the state tennis data, we're still near the back in vaccines distributed per capita. Any more information on why that may be occurring, perhaps?
So there's two things within tennis that we really had reinforced this past week. One is, and again, it's Shelby County wide, it's not just the health department. There is vaccine that's been given that has not been properly entered in tennis. And when I say properly entered, it means it may not have been closed out or it may not have been reconciled in the system. So we really are encouraging all of our partners and also looking internally to make sure that all the data is entered in a timely manner. That's one. The other is within the system is actually an inventory control mechanism as well. And that is a second step that has to be done, and it became evident at the end of last week in our conversations with the state that many of the local partners are not taking that second step to reconcile the inventory and that the actual total numbers come out of that inventory control. So that's a data issue that we're addressing in partnership with the state and our local partners.
Katie Reardon, WKNO.
Hi, Dr. Haushalter. I'm curious, I know the health department hasn't been tasked with distributing vaccines to long-term care facilities, but I'm wondering if you can shed light on where that's at in the process and if the allocation to those are included in that 11,000 doses that you think you'll get for the rest of the remainder of the month.
Great question. So no, that is not counted in our 11,000 doses. And my understanding is that for the pharmacies that have a contract to be able to reach out to the long-term care facilities, that they are near finished with that. My understanding is they were going to each make about 3 visits to a facility, 1 first dose and second dose. But also what they found is on the second visit, individuals decided to get the vaccine that did not want it previously, so they have a 3rd visit that allows for an additional follow-up.
Great. And then I had another question, and Brad sort of asked about this, but the percentages of those priority groups that have been vaccinated. Do you have any more numbers on, where are we at in the percentage of first responders that you think you've completed, the number of healthcare workers? Like, can you shed any more light on percentages completed in these top priority groups?
Yeah, so I don't have that with me today, but I've actually asked David and his team to begin to calculate that. So there are, in the phases, there were population estimates that the state utilized, and so based on those population estimates, can we account for who was covered or not covered? Now, in some cases, that data may not be in the system. For example, it may not list that someone's a paramedic or an EMT. If it doesn't, we can't report on that, but we can clearly report on age categories, so more to come on that.
Jonae Lewis, WREG.
Hello, can you all hear me?
Yes.
Okay, so I just have a question regarding eligibility and people showing up to vaccine appointments. We've received some information that people are showing up and they haven't been asked to show any proof of eligibility. Can you clarify if people come for vaccine appointments, if they're still supposed to be taking any proof of eligibility, and then what impact is that having on the supply with such a great demand of people who aren't eligible to be vaccinated are receiving them?
It's a great question. So we do want people to bring proof of eligibility, so we can ask for that if we so choose. And then I'm also going to make a statement that I hope people will take to heart. Every time somebody who is not eligible for vaccine makes an appointment and gets in line and gets vaccine, that means somebody who's at risk of dying from COVID did not get an opportunity for vaccine. So I want to highly discourage people who are not yet eligible for vaccine getting in the line to get vaccine. We want to make sure that we are focused on those people who are most at risk, and that's to reduce really deaths and hospitalizations and suffering. We will continue to do the best that we can to make sure that people are, who are eligible get vaccine, but unfortunately we know of cases where people have been dishonest, or they have said maybe they've misrepresented themselves as to what category they fell into, which is seriously problematic because we need our seniors to get vaccinated.
Is there anything being done, I guess, in the terms of training or keeping an eye out on these kinds of cases that are happening to prevent it for the reasons that you previously spoke about?
Yeah, so anytime it's been made aware to me, I actually will ask the team, or I'll do it myself, to really get to the root of what happened. How did that person get an appointment? How did that person get in the line? What did they say? Were they misrepresenting themselves? And so on. The reality is, for any vaccine effort, we have to rely heavily on people being honest and forthcoming. And so if someone says they're a healthcare worker, and when they may in fact not be a healthcare worker, it is very difficult to spend the time to challenge that. So I really am imploring the public to allow those who are eligible for vaccine to get vaccine. But yes, we do quality improvement. We look at what the contributors were and what we can do differently to continue to reduce that.
We are out of time. Are there any closing messages today?
just encourage people to continue to be patient as we learn more about what our vaccine supply will be, to go to shelby.community and go there frequently, so as we have more appointments, we will open those up for the public. Thank you.
Thanks, everyone. We'll see you back here on Thursday.